All right, everybody, welcome back to the EKG review here. Let's go ahead and get started. So, first thing I do is I look at the kind of overall rhythm here, and I look and I see I've got these narrow QRSs that are marching along. They're occurring pretty normally in a regular rhythm. My rate is going to be 300, 150, 100 beats per minute. So we got tachycardia. This is a narrow complex tachycardia. Narrow complex. That makes me think that, okay, must be coming through the AV node, through the ventricle. So this must be an arrhythmia that is either at the AV node or above the AV node. And so my next thought is, well, what is my atria doing? I see there's some atrial activity for these QRSs, but look at when I look at my limb leads here, 2, 3, and AVF, what do I see? I see negative P waves in the inferior leads. So negative P in the inferior leads. And that's not what I would expect if this was a sinus P wave. The sinus node lives in the upper right part of the atria, and when it depolarizes the atria, the sinus node depolarizes down to the left. So usually we see upright P waves here. But I'm seeing these ectopic P waves that are causing atrial depolarization. And so these P waves are arising from some ectopic focus. So we can go ahead and say we've got this ectopic tachycardia. But we're not done there. We've got to evaluate our AV node and look at the PR interval, which PR interval is less than 200 milliseconds. So that is normal. Let's look at our QRS duration. It seems to be narrow. If I kind of find right where that QRS starts, it's a narrow QRS, less than 120 milliseconds. We have QRS that is upright in lead 1, upright in AVF, which means it's going down to the left, which is a normal QRS axis. When I scan throughout, I see I've got good R wave progression as I move through the precordium. And when I look through for my ST and T wave segments, I don't see any focal abnormalities that would make me concerned for some type of ischemia or infarction, and I don't see any pathological Q waves. And so what's this rhythm? This is an ectopic atrial tachycardia. So, hope this helps. Have a great day.